Testing is all we can really do right now to mitigate the effect of the virus, but we cannot test our way out of this pandemic. The virus is spread because of human behavior, and changing human behavior is the only way we get out of it. A rapid diagnostic test is a medical diagnostic test that is quick and easy to perform. RDTs are suitable for preliminary or emergency medical screening and for use in medical facilities with limited resources. In response to the growing COVID-19 pandemic and shortages of laboratory-based molecular testing capacity and reagents, multiple diagnostic test manufacturers have developed and begun selling rapid and easy-to-use devices to facilitate testing outside of laboratory settings. These simple test kits are based either on detection of proteins from the COVID-19 virus in respiratory samples. Examples are sputum, throat swab, or detection in blood or serum of human antibodies generated in response to infection. Some clinicians have used this test for antibody responses to make a presumptive diagnosis of recent COVID-19 disease in cases where molecular testing was negative but where there was a strong epidemiological link to COVID-19 infection and paired blood samples. There are three types of COVID-19 tests. The first one is genetic or molecular tests, are most accurate and include the reverse transcription polymerase chain reaction test to pinpoint ribonucleic acid from saliva or a nasal swab. Second one is the antigen test. Find specific proteins on the surface of the virus. And the third one is the antibody test. Can determine if the person had a virus but it won't spot active infection. What are antibodies? Antibodies called immunoglobulin M or IgM help identify recent infections. Some antibodies are made early in an infection and go away, usually within a few weeks, while others can linger for months or even years. Immunoglobulin G or IgG stays around longer. A third antibody, immunoglobulin A or IgA, plays a role in the immune function of mucous membranes. For illustrative purposes only, tests are described by their positive and negative predictive values. These measures are calculated using a test sensitivity, its specificity, and using an assumption about the percentage of individuals in the population who have antibodies to SARS-CoV-2 prevalence in these calculations. Antibody or immunoglobulin or Ig, a protective protein produced by the immune system in response to the presence of a foreign substance called an antigen. So ayan, nakita po natin yung IgG niya, one line siya, so negative. So yung isa yung IgM niya, under na siya, so let's read the result. Protect yourself and others from COVID-19. You can reduce your chances of being infected or spreading COVID-19 by taking some simple precautions. First is regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap or water. Why? Washing your hands with soap and water or using alcohol-based hand rub kills viruses that may be on your hands. Second, maintain at least 1 meter distance between yourself and others. Why? When someone coughs, sneezes, or speaks, they spray small liquid droplets from their nose or mouth which may contain virus.
Kasi meron ng isang linya.
Meron na kasi isang linya. Basta ang nag-isang linya, negative na siya.
Mabilis lang pala.
If you are too close, You can breathe in the droplets, including the COVID-19 virus, if the person has the disease.
Negative test for Kristen. So, magpapa-ice cream daw siya.
Wow, ice cream. Pero yung
Third, avoid going to crowded places. Why? Where people come together in crowds, you are more likely to come into close contact with someone that has COVID-19, and it is more difficult to maintain physical distance of 1 meter.
As much as possible, if you don't have any important things to do outside, always stay at home. And most importantly, pray, read, and meditate the words of God as our best defense in our spiritual battle.
So may tatapon na kasi yung details yung nandito, yung lot number, ganun. Ilalagay niyo dito.
doon sa may papel.
Dito sa papel.
Bongga! Congrats! Isa namang puto pala siya dyan.
So huwag may tatapon to kasi isa lang to. Hindi siya disposable, no?
Kaya nga picture. Ikaw.
Ako talaga? Si Sir Tristan dapat
Kayong dalawa.
Okay, ako daw yung judge.
Kasla kayo lang.
Negative.
Okay. 1, 2.
Avoid touching eyes, nose, and mouth. Why? Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to your eyes, nose, and mouth. From there, the virus can enter your body and infect you. Make sure and the people around you follow good respiratory hygiene. This means covering your mouth and nose with your bent elbow or tissue when you cough or sneezes. Then dispose of the used tissue immediately and wash your hands.